I'm Azadeh Atyabi, and I'm happy to be coming to you with another episode of A to Z Immigration. I hope that wherever you are in the world, you've been having a good time and are doing well. And I hope you have the patience to listen to my remarks for a few minutes so we can see what's been happening in America these past few weeks for our dear Iranians and other immigrants. As you know, the US government has been in a state of shutdown since early October until now because Congress was unable to approve the budget for the year 2024. And there is a major disagreement between the two parties, the Democrats and the Republicans, over the budget for the coming year. One of the biggest disagreements they've gotten into, which caused the government shutdown, one of the biggest government shutdowns in American history, has now continued for about 36 or 37 days. And the main source of their disagreement, one of the biggest ones, is over the issue of that same health act or that same health insurance. It seems that they have decided to cut the budget in a very significant and substantial way for the next year. And this change can be quite impactful and potentially have important consequences for individuals who have obtained their health insurance coverage through Obama or that same CARE Act. This could affect people who rely on these programs for their healthcare needs. If you remember, during President Barack Obama's administration, they introduced a program. At the time, it was essentially universal insurance they called it affordable insurance so that everyone could get health insurance based on their income. And although, it's not really that affordable, meaning it really wasn't cheap insurance at all. But apparently, anyway, the federal government during the time of the coronavirus pandemic provided additional subsidies, meaning more cash assistance and financial support for this particular program. This was done so they could bring the monthly costs of the insurance down a bit, making it somewhat more manageable so people could better afford to get insurance coverage for themselves and their families. In other words, the government stepped in to help lower the price at least a little so that more people would be able to purchase insurance, even if it still wasn't exactly cheap. And now, at the end of the year 2025, that budget is ending, meaning the subsidy budget for the Obamacare Act is ending. Now, the Republicans really do not want to extend this any further. And if it is not extended, it can have a real significant effect on insurance and the monthly costs of insurance, a very big effect. They even say it could reach double the cost. Now, consider, who does this really put under pressure? In American society, those whose income is very low, they can go on government insurance plans that we've talked about many times, Medicaid and Medi-Cal and so on. Those who are over 65, they have Medicare and are covered by that federal insurance. That segment between 18 and 65 who work are affected more than anyone, who are also employees, mostly those who are on Obamacare. And if they are not going to give this subsidy or extend it, at least not extend it for another year, which so far the Republicans have not accepted, they haven't accepted, and they want to cut this. It can have a very big effect on the middle class, on the working class. And alongside it, it will have a very big effect on government insurance plans, which are that same Medi-Cal, Medicare, Medicaid, and a series of subsidies that those insurances had. You see, this is something that really affects a person and can truly make you upset or distressed, this system that operates in America. Aside from that, you see a segment of people who come as immigrants, like our parents, and we often say how good it is, how much service and support they receive here. But the truth of the matter is, for the majority of immigrants who come here and are working to be able to support your life, you don't even become entitled to that Medi-Cal insurance or to your Medicaid insurance. And how can you afford to pay $700 or $800 a month, which is the current cost for the cost of treatment, meaning they pay $700 or $800 a month for insurance? Someone who, for example, has an annual income of $70,000 or $80,000 has to pay around $700 for even the lower tier Obamacare plans. And this is what they call affordable, meaning the federal government is putting money towards it, a subsidy. Anyway, that is being cut, and this is a very important factor. Now, we hope to see where we end up, but this government shutdown, while it's called a government shutdown, the effects it's having right now, you see, I haven't looked up the exact numbers in America to give you, but a whole lot of federal employees, government employees have been furloughed. That means non-essential workers have been asked to go home without pay. Well, these poor people who are making $6,000 or $7,000 a month and have to pay rent and this and that, if they don't get paid, where are they supposed to get the money? And those whose jobs were essential, the poor souls, are at work without pay. This has caused first a reduction in the workforce, and as a result, there's more pressure on the segment that is currently working without pay. And beyond that, it has also caused some government tasks to fall behind, and they are unable to provide even some benefits right now. Here, I want to give you a bit of an update on how this government shutdown affects benefits, so that if you receive them, you know what to expect. For those of you receiving SSI or SSDI, meaning government benefits, fortunately, that comes from the essential federal budget and is not related to this issue. That budget is now fully secured. The money is being deposited, and fortunately for those who are disabled or retired, your money will not be delayed. You will receive it right on time. But for individuals who receive food stamps, meaning support for food costs, you might know it as SNAP or food stamps, you should expect that for this month of November, it might not be deposited into your account, or a smaller amount might be deposited, or it might be delayed, because its budget has not been secured by the federal government. And unfortunately, something like 40 million Americans are on this program, the SNAP program. And never mind that we see some dear people around us, individuals who might not be in great need of it, but there are truly families, especially low-income Americans, who genuinely rely on that food stamp money for their groceries, for putting food on the table, and for making sure their loved ones do not go hungry. That's why in California, they've increased the number of food banks, they've gotten some volunteers, and they're trying to get food to people for this month until they see how this situation resolves, how long this government shutdown will go on, and what its effects will be. A court stepped in and blocked it, saying they shouldn't stop the food stamps because it truly affects people's lives. But the Trump administration overturned that court's ruling, and in any case, it's still on hold. Some of the things that right now some government agencies are still open. Even the Social Security Administration is open, but only essential tasks are being performed, my dears. Because of this, you should expect that if you're waiting for certain documents, papers, or for some cases to be processed, there will definitely be delays in all of these. And then another issue is for people who are in contact with the immigration organization. Last week, 2 or 3 people called me saying, we have our citizenship appointment. Should we go? Should we not go? It's for our citizenship. Yes, that has not changed. You should still continue to proceed until they officially notify you. Otherwise, keep your scheduled appointments. The USCIS organization, because the money for processing many of these cases comes from the fees that you yourselves pay. That application fee covers the cost of processing these cases. As a result, it's not very dependent on the federal government, but some of its internal operations can be dependent, which causes delays in cases. And also consider that the USCIS organization is, in any case, overloaded, meaning the volume of cases has increased so much since the new administration took office because everyone got scared. Everyone wants to update their files. So the volume of cases and applications has gone way up. And I mentioned once, they were saying there were several million cases in envelopes that hadn't even been opened yet. I was reading this in the news until last month. This will have some effect. Another issue that the shutdown, meaning the government shutdown, has affected, and you really need to pay close attention to this, is the important issue of flights. Because it's the holiday season, my dears, and everyone wants to fly here and there, whether it's within the US or you might have travel plans to visit loved ones or travel for leisure anyway, because of This shutdown, the U.S. Aviation Organization has announced that it wants to reduce the volume of flights by up to 10%. This is to increase flight safety. Because it seems some parts of this National Aviation Organization are well funded by the government, by the federal government, and this budget deficit has caused them to have fewer employees and for hours to go up or on flight safety. I know there was an incident in one of the states that caused two planes to collide, and they said the air traffic controller missed it because there was only one person in the control tower due to staff shortages. And it led to an accident. Well, we all know what happens when two planes collide. In any case, this is certainly not good news that we are hearing here in America, but it is unfortunately something that is happening. And we sincerely hope that in any event, this government shutdown will at least be resolved soon. Let me remind you of a very important issue here regarding the DV Lottery 2020, which I had announced in previous programs would open in October and continue until November. This has been the usual annual process, my dears, but this year, due to these issues, the DV Lottery 2020 website has not opened yet. So please pay attention. I want to emphasize this completely. As you're listening to this program, we are now in the first week of November since this program is repeated. I won't give a specific date, but just know that as of the first week of November, I'm telling you it has not opened yet for the DV Lottery. And if you see a place that says you can register, know that you cannot. USCIS has also officially announced this. And for now, we have to wait and see when they will open it, and I will certainly inform you on this program. Another part I want to remind you of is, for those of you who have Medicare, know that it's open enrollment. It's the period you have until December 7th. You have another month, you have about another month to make any changes you want to your Medicare plans. Now is the time. If you would like to make any changes or updates to your Medicare Advantage plans or to any other parts of your Medicare coverage, please contact Medicare for assistance. Now is the perfect time to do so. Please be sure to consider this so that, God willing, you can make the changes you want correctly and at the right time, and it will start working for you from the beginning of the year. Thank you. These were some explanations anyway about the impact that the government shutdown has had on plans and programs. Let's take a break, listen to a music video, and we'll return with the rest of our discussion about immigration programs for Iranians here. Thank you.